is our way. Oh yeah, any day, from the north to the south, the east and the west. Let us work hand in hand. Lagos health is our wealth. Oh yeah, any day, let us work hand in hand. Lagos health is our wealth. ILERA EKO Lawale, ILERA EKO Lochewalogo. Let us work hand in hand. Lagos health is our wealth. Oh yeah, any day, let us work hand in hand. Lagos health is our wealth. ILERA EKO.
Good morning and welcome to ILERA EKO Extra on Lagos Traffic Radio 96.1 FM. Good morning, Lagos. Yes, like I would always say, we should celebrate the gift of life and not forgetting the gift of good health, a treasure actually that requires our collective care and attention. As we navigate life's uncertainties, it is very, very pertinent and very, very important to have a safety net. And that's why the Lagos State government, through the Lagos State Health Management Agency, introduced ILERA EKO, which is a groundbreaking health insurance scheme that makes quality healthcare accessible and affordable. Join me on this informative journey as we take you through the strip, informative, giving you information that will, of course, help you access quality healthcare at affordable cost. Yes, my name is Akan Usen, welcoming you to ILERA EKO Extra right here on Lagos Traffic Radio 96.1 FM. As part of the ongoing efforts, to sensitize and, educate the public, educate Lagosians about the benefit of ILERA EKO, on the show, which of course comes up every Monday at around this time up until 11 o'clock, we came up with a segment on the show, which is the drama series, a docudrama series. And we've had 4 episodes so far. Today will be the 5th episode. And today we'll be shining our light on a very, very interesting topic that I know you definitely, love to, listen to, love to learn from. And so I just need you to do me one favor. And what is that? It's your attention. We need your attention. If you're driving, of course, I'd love you to, give your attention to the road, but just lend us your ears and listen. It definitely would be a very educative time. Welcome to ILERA EKO Extra, and straight away we will be going to the drama series. A quick bit of information over not the weekend, last week, actually, LASHMA, Lagos State Health Management Agency, won the prestigious State Social Health Insurance Award of the Year 2025 from the Nigerian Healthcare Excellence Award. That's NHEA. That was last week. So congratulations to LASHMA. Of course, that just shows the giant strides that the Lagos State government through LASHMA is achieving in, expanding, making sure universal healthcare is achieved. Okay, so straight away, without further ado, let's just go listen to our drama series. Of course, today's episode is titled Expanding Drug Access. ILERA EKO Expanding Drug Access. Do enjoy.
The Lagos State Health Management Agency, LASHMA, now them bring this Ubunga drama come to this title now, Expanding Drug Access, Community Pharmacy.
ILERA EKO, Lawale. ILERA EKO, Lochewalojo. Let us work hand in hand. Lagos Health is our way. ILERA EKO, Lawale. ILERA EKO, Lochewalojo. Let us work hand in hand. Lagos Health is our way.
Now wetin dey happen here now? Doctor say make una give me 5 medicine. Now they give me 2. Wetin happen?
Na only 2 we get. You go collect the remaining 3 for pharmacy outside.
Look me well. Now illiterate you called me. You want enter me?
No be so, sir. We no get the medicine for here.
Look, government don't talk and say anybody where e dey for ILERA EKO standard jara, any medicine where doctor say make it na dey give am, make it dey give them.
Na true. Now wetin make me tell you say make you go pharmacy outside go collect the remaining one be that.
Give me my medicine now. If una no give me my medicine now, I go mess you, I expose you all the mago wey na dey do for this hospital right now. Then make una give me my medicine.
Sir, calm down. Wetin my second dey try explain to you be say we no get all the medicine for here, but Lagos State government don make arrangement with some pharmacy outside where you go fit get am.
Okay. Wetin different with the thing where you dey talk or this one dey talk? Wetin different? Give me my medicine right now. Make una give me my medicine. If you na go give me my medicine,
Why no still every wetin dey happen for here?
And now your people want cheat me.
Pharmacist Grace, wetin dey happen? No be so, ma. Na true say na 5 medicine you prescribe for Baba, and na only 2 we get for store here. I come dey explain to am say make you go collect remaining 3 for pharmacy outside. But you no understand me.
They not cheat you at all, Papa. See, na see B, na so they tell you so.
Na so wetin be? Na plan work. Na wetin na plan work. Na plan work.
Calm your temper. See, any medicine where you not see for here, you go outside pharmacy go collect them. Now the program where Lagos State government don't sama put for grant, then they call them community pharmacy.
Baby, I don't hear that one. I don't want that one. Make una give me my medicine. If you don't give me my medicine, if you not give me my medicine, I will not this place. I will carry this place. My chairman.
I just dey hear your voice when I dey comot from the doctor now. Wetin happen?
Say now my chairman be this for my community. You know me well. You know what I can do. You know what I know fit do. If I tell you, make una give me my medicine complete, and I no give me.
Baba Joe, wetin happen?
Thank you, my chairman. Now doctor, this doctor give me 5 medicine. He say make I go collect am from them. I can't reach here and I can't tell them. They can't they give me 2 medicine out of 5 medicine. Now here I can't they ask them say where the remaining 3? They no one give me. They won't cheat me. Me where they pay my ILERA EKO correct.
Not be so the matter be.
Doctor, make you no worry. I know the thing where they happen.
I know my chairman. No, wetin dey happen now. I won't cheat me now.
Baba Joe, they no cheat you. They not cheat you at all. Now for our betterment, now make Lagos State government arrange community pharmacy for us.
Where did that one come in?
As them talk say make you go collect 5 medicine and then give you 2 medicine out of the 5. Go to pharmacy where they near your area, collect the rest 3 without paying kobo.
So I no go pay kobo.
No go pay.
Now so. Now wetin we dey try explain to you since be that.
But now no explain to me as my chairman explain to me now. That one dey okay. But how they go know the medicine where they go give me when I reach there? They no give me any paper now.
You no need any paper at all. All the test results and the medicine where I write for you, everything dey for inside computer. All the thing where you need to do na to waka go any pharmacy. Make you show them your ILERA EKO policy number. everything go show for their system.
Ah, that one fantastic, oh.
Only people waiting for admission and elderly people them. Now them the government say make we give their medicine complete.
So me, I no be elderly like this.
Babajo, you be elderly man, but you still fit the day well, you can't wait.
Ah, my chairman, you know me oh, when I start the box, where are the box, you know me well. So if I box them, once a boxer, always a boxer.
We go expanding drug access, community pharmacy. Now for people wey come hospital come see doctor, when we know as outpatients, those wey them don't discharge. But for the following people, hospital must to help them get their medicine. Elderly people, emergency, people wey dey for admission, woman wey get belle, injection, and disabled people them. But the community pharmacy no dey for night after 8 o'clock oh, and for weekend.
My pikin, no be this type what they use oh.
Now the same thing, this one too they work well.
Ah, thank you, my pikin. ILERA EKO, all correct.
For better informative, carry waka come our head office for Good Shepherd House, opposite Secretariat Alausa Ikeja, or call this number there 0800 ask LASHMA. That na 0800 2755 27462 or 0916 9185 920 or WhatsApp for 0704 535 8275. ILERA EKO, it don't leave anybody behind.
ILERA EKO, now and then. ILERA EKO, but you're alone. Let us work hand in hand. Make us health is our way. ILERA EKO, now and then.
Welcome back. And yes, it was quite an interesting one, I must say. A bit hilarious. And yes, I'm sure you learned one or two things from it. So that will be our talking point on the show today. And to talk about this, I have a guest. I believe it's her first time on the show. We have with us Miss Funmi Benjamin. She is Supply and Logistics Officer with the Lagos State Health Management Agency, LASHMA. You're welcome.
Thank you very much for having me.
Yes, it's so great having you with us. And I want to say welcome, the very first time here. And wonderful. I'm sure we're going to have a great time. Our focus, of course, will be all about ILERA EKO expanding drug access. Now, we all listened to the docudrama and quite an interesting one. But, you know, just for sakes of... for people who perhaps didn't get the entire meat of the conversation, the drama and everything, for people who might have missed that, what is ILERA EKO expanding drug access initiative all about? Why did it come about? And let's talk about that for a bit.
Okay, so ILERA EKO Drug Access is a program that is launched April 2024.
Okay.
By LASHMA to make medication more accessible and more convenient for its enrollee.
Okay.
After we reviewed common challenges from enrollees.
Okay, so that was, you got it from feedback from enrollees, okay?
Such as unavailability of medication in some hospitals,
okay,
and out-of-pocket payment for covered medication.
Okay.
From the enrollee. So as at June 2025,
yes,
we have a total number of 218 community pharmacies. So for now, selected community pharmacies
218.
In the state, yes.
Okay.
So selected community pharmacy now serves as official pick-up drug points for enrollee. So enrollee can easily go and pick up their medication. So recently, last month, we just onboarded a new pharmacy, a community pharmacy in Ekpe.
Okay.
Also. Okay. So we have it all across the 20 local governments in the state.
All across.
Yes.
Wow, interesting. Now, who exactly is, like, everybody on the ILERA EKO platform, and everybody who are on board with the scheme and all that, who exactly is qualified, or who is supposed to access? Who can access this?
Who can pick up medication in the community pharmacy?
Yes.
Okay, so all outpatients.
All outpatients.
Yes.
Okay, that's people.
If you are not on admission.
Okay.
If you are not pregnant.
Okay.
If you are not physically challenged or old.
Okay.
If it is not an emergency, if you are not on admission, so you are entitled to pick up your medication at the community pharmacy.
Okay, so the elderly people will be
Yes.
attended to.
The physically challenged
in the hospital.
Yes.
Okay.
If you are pregnant, all your routine medications and every other thing
will be given to you
at the hospital. If you are on admission, for the number of days you are on admission, your medication will be given to you in the hospital, both orally, parenteral, injectables, and on. Community pharmacy do not dispense injectables.
Okay.
Yes. So
only the hospital has that right to do. So okay, noted. Because we get a few people who call, and it seems a few of them do not really understand. They say, "Oh, I went to this hospital, and they told me to go."
Yes.
And okay, so this makes a whole lot of sense. Okay, so expanding drug access, how will this benefit enrollees in accessing their medications?
Okay, so most of the community pharmacy are just a distance walking away from the hospital. So most of them are within the community.
Okay.
You understand? So it is not like
it's actually not too far from the hospital.
Yes,
okay.
It's not like it is something that is too very far. Then at times, the medication are always available.
Okay.
You understand? So instead of putting much pressure on the hospitals, you can just go to the community pharmacy that are under the scheme and definitely pick up your medication. You understand? So then when you are done with your consultation and every other thing, instead of waiting for a very long time to pick up your medication, you can just
go
to the community pharmacy to pick up your medication. Yes.
Okay. So you said the medication is always available there. How about haven't there been instances where even at the pharmacy it wasn't available, or in such what would happen in such an instance?
So that you have the right to pick up, to go to any other pharmacy.
Okay. Still within the network.
Yes, within the network. So we have a rule in our unit.
Okay.
If you don't have the medication,
yes,
do not write it that you've dispensed.
Okay.
So the enrollee can still have access to pick up from another pharmacy.
Okay.
Under the scheme.
Okay, so there's a way to communicate that.
Yes.
Okay.
Yes.
Okay.
Yes.
Okay. That's amazing. Okay, let's talk about how does it work? What's the procedure from the point of care, from the point of you see the doctor, and let's just explain it right from consultation to accessing care and getting drugs.
Okay, so the enrollee goes to you have to select the hospital that you want under the scheme.
Of course, that has been done already.
Yes.
You are on the scheme. Yes.
So after the consultation, you meet with the doctor for consultation. Then a test might be carried out. So depending on the result, so it can now be: is it an emergency case? Are you going to be on admission? Is the enrollee pregnant and all that? Physically challenged and every other. So all those ones will be attended to. Yes. But if it is just normal ailment, you just want to see the doctor, then pick up your medication, then your outpatient medication goes straight to the pharmacy. So the pharmacy dispense tablets, capsules, suspension, syrup, suppository, cream, and ointments. They do not dispense injection.
Okay, so for the benefit of some of us who don't have, could you just tell us, explain in layman's terms? We know tablets, we know capsules, we know suspensions. Suspension is the powder where you
add water to
and shake, and then the other ones we don't.
So suppository is the one you can insert into your anus, to cool down the temperature, and all that. You understand? So creams are those ones that you can apply on the affected area.
Yes.
So that's just it.
Okay. So anything outside this ones you mentioned,
the community pharmacy do not dispense it. Yes.
Okay. So we're talking about the procedure. So you go there, and what happens? What will the person take there? Is there?
Okay. So when you are going to the community pharmacy, when you get there, you present your enrollee ID.
Okay, that's all.
Yes. So it is with the enrollee ID that the pharmacy input on the system, and your information will definitely come out. The medications you are collecting and every other thing, your information, the pharmacy can see it from their end.
Okay, so that means the prescription has already been...
Yes, the hospital will upload the prescription.
Okay.
So the pharmacy will see it from their end.
Okay. Yeah. Okay. So everything... So it's not like someone...
No. So everything is... electronic,
yes. It's digital. But haven't there been instances where, of course, we know not everything is 100% foolproof? What if downtime and maybe
Yes. So
it
when
cannot be uploaded.
so when there's downtime,
Yes.
We have hard copy prescription
Okay.
from LASHMA.
Okay.
So the hospital writes the prescription
Okay.
on the hard copy. So it's that hard copy you take to the community pharmacy so that the
Okay.
community pharmacy can then attend to you.
Okay.
We are in Nigeria now,
Yeah,
so
of course,
network is
of course. But would there be after the person like accesses, gets the drugs, gets the whatever he needs to get from the pharmacy? Will there be feedback to LASHMA, or how would they make sure that person does not take said prescription, for example, hard copy?
The pharmacy definitely collects the hard copy, and
Okay.
we in the unit we actually know that the medication has been dispensed.
Right. All right, dear listener, we have been having an interesting discussion about expanding drug access under the ILERA EKO scheme. Yes, we have the Supply and Logistics Officer at LASHMA, Ms. Funmi Benjamin, shedding light on this very important topic. And she has really taken us on that journey, explained a lot. Of course, now we know that it's only outpatients who are actually would actually get to enjoy this. Every other category, the elderly, physically challenged, and pregnant women, actually you will get your drugs and your medication from the hospital. Let's just do a quick detour and see what traffic is looking like. I can tell you that as regards an earlier reported incident from the Victoria Land axis, this was around just before the news, a collision between a Toyota 4Runner Jeep and a Kia Saloon car at Ozuma Madiwe in Ward Kilimanjaro. I understand there was one casualty who had been taken to the hospital. The update is that both vehicles have been moved off the road, and traffic managers are on ground restoring free flow of traffic that has been attended to. Also, another update, an impediment earlier reported, the one at Obanikoro in Wat Antoni. I understand the mechanic is on ground working on that. It's a PSP compactor truck on the main carriageway at Obanikoro in Wat Antoni. And we have traffic managers stationed there, making sure things move as smoothly as possible. So if you're heading in that direction, of course, just watch out for that as you head in that direction. Also, Iyanoba Service Lane onwards Mile 2, there is a report of a broken down Mack tipper truck. Efforts are still on to move said impediment of the road, but as regards backlog, not much effect on traffic, but it wouldn't hurt to just watch out for that as you head in that direction. Of course, if you're heading in that direction, we still have our guest, Ms. Funmi Benjamin, Supply and Logistics Officer, LASHMA, and we have been talking about ILERA EKO expanding drug access. Okay, so I would like for you to join in the discussion. If you'd want to ask any question, you want to seek clarification, or perhaps there's any aspect you do not really understand and you would want my guest to just shed light and explain in details. 091-538-77127. That's the number to call. 091-538-77127. That's the number to call. You can also send a WhatsApp message to 080-991-20777. That is 080-991-20777. I'd love to hear from you. Sixtus says, good morning, everyone in the studio. Very important discussion, sincerely. Sixtus from Abulegba. Thank you, Sixtus. Much appreciated. All right, so Miss Benjamin, okay, so we have actually talked about the entire process, how from consultation to accessing care and getting drugs. But how will the enrollee know that this pharmacy is accredited under ILERA EKO?
Okay, so every month,
okay,
the unit send an updated list to the hospital.
Okay.
So the hospital has the list.
Okay.
So then all accredited pharmacy under the scheme, we do have like a banner,
okay,
like a sticker rather,
okay,
that shows that you are part of the scheme.
Okay.
And on our website and on all our social media pages, we also update it regularly. You understand? Then enrollee can also call the customer care to tell
Okay,
them
tell them.
which of the pharmacy is the closest to them.
Can it also be maybe accessed online?
Yes,
Okay, so there's a list online we can just like
yes,
okay.
on the website and
Okay.
on all our social media pages.
Okay. But just take us through. Is it possible to get to know how you accredit the pharmacies? Is there a process? How do you get to vet them? Is it possible?
Nah, I
Okay.
think it's in-house.
It's in-house. Okay, so we just know the pharmacies are accredited under ILERA EKO, and they've gone through a very strict, rigorous process, vetting them and all that. Okay, so at this point in time, I just want you to give your final advice to enrollees concerning expanded drug access initiative. But before we do that, I would want you to tie in a bit of information. I know your forte is the pharmacy aspect, accessing drugs and all that. But the product right now on the table is the ILERA EKO standard JARA. So let's talk a bit about just maybe a bit of a just overview.
So it's a basic health insurance plan,
Okay.
and it is going for 15K a year for
Individuals, okay.
Yes, and 55K for a family of 4.
Okay.
That is the father, the mother, and 2 kids.
Okay.
Under 23. The kid has to be under 23 years old.
Okay.
Then we have for a family of 6, which is 80,000 naira.
Okay.
So that's the father, the mother, and 4 kids.
Okay.
Both under 23 years.
Okay. Is it possible to get to know a few of the benefits? Is it possible?
Okay, so there is general consultation,
Okay.
specialist consultation. That's
Right.
just 4 visits.
Okay.
Then there's physiotherapy. There's 5 sections.
Okay.
There's treatment of common ailments.
So like
There's,
malaria and all that.
There's treatment of childhood illness also. There's family planning services. There's eye care. The limit is at 10,000 for frames and all that. Yes, then we have dental care also. Then antenatal care also.
Okay, great one. I have a question on WhatsApp. Morayo. Good morning, my name is Morayo. I want to know if there are hospitals that are accredited under ILERA EKO scheme, and what does it... Okay, how do I word this question? I want to know if there are hospitals that are accredited under ILERA EKO scheme, and what does it comprise of? Of course, we know there are hospitals under ILERA EKO scheme. Yeah, all the hospitals under the... Yeah, so, Morayo, of course, at the point of you registering, you would get to see the list of hospitals, and you get the hospital closest to you.
Closest to you, yes.
Okay, great. I have another question. This one, okay, you didn't state your name. What about a family of 7?
Mariah can also check the website.
Yes,
also.
so Mariah can check the website. What about a family of 7? You talked about family of individual. You talked about family of 4 and family of 6. So this person is asking for family of 7. What happens?
So they have to pay. They have to pay additional 10,000.
Additional 10,000 for the extra head, extra person. Okay. So I guess you understand that. So family of 7, the 7th person would get to pay. You have to pay an extra, and the person will be still under that cover. I hope that helps. Okay, so moving along. If we need further information as regards expanded drug access, or people that want to still find out a lot more, what are the numbers we can call?
Okay, so you can call 091 69 18 5920
okay,
070
okay,
40
40
277
okay,
029.
okay,
Or you can send us a WhatsApp message on 070
okay,
4535 8275 or 070 46 16 0051.
okay. All right. So this person says, what does the What does ILERA EKO scheme? Okay, so perhaps we'll just reach out to you. We'll reach out to you with all the information. Someone will reach out to you, Morayo, at the end of the show with all the information you need as regards ILERA EKO. I see that perhaps you need someone to, just maybe one of the sales officers. Yeah, thank you. She says, okay, noted. Thank you. Thank you very much. And so what is your final word as regards expanded drug access and, let's Lagosians hear you and your advice to Lagos residents about ILERA EKO in general.
To all ILERA EKO and really listening today, this program is designed for your benefits and to bring healthcare closer. So please take full advantage of this and please tell others and spread the word. So please, we are expecting your feedback. We encourage our enrollees to actually trust the process, and when they are unsure, they can ask questions.
From any of those numbers.
Yes.
So for good measures, let's just run through the numbers again.
Okay, so for calls,
yes,
you can call 091
69
18 59 20 or 070 402 77 029. Or you can send us a WhatsApp message on 070 45 35 8275.
All right, it's been quite an eye-opening session on the show, and I'm sure Lagosians are the better for it. As we conclude today's episode of ILERA EKO Extra, dear listener, remember your health is your wealth, like I would always say. Please, as much as possible, invest in your health because you're investing in your future. Don't wait until you fall sick. Don't wait until your loved ones fall sick. Enroll on ILERA EKO today. Come on board with the standard JARA and or the senior citizens plan, seniors plan, or what other plan do we have? Okay, standard JARA Plus, which of course is the latest entry. And with all this, you secure a healthier tomorrow for yourself and your loved ones. Do well to reach out. Any of the numbers we called, or perhaps you could go to the website www.lashma.com. I got that correctly. Visit the website or any of the enrollment centers. I know they're everywhere, and you could see the kiosks, or perhaps just come to Good Shepherd House, which is directly opposite the Secretariat, Lagos State Secretariat, and go there, ask any question. They will definitely be ready to assist. A big thank you to Mrs. Adeyinka Gwemigbade, Assistant Director of Public Affairs of LASHMA. Of course, today is her birthday. Yes, happy birthday to her. I know she wouldn't want us to do this, but of course, wishing you a brighter and more beautiful year ahead, filled with God's goodness and blessings. Okay, thank you for tuning in. Also, a big thank you to Victor Terry and to you out there. Thank you for tuning in to ILERA EKO Extra on Lagos Traffic Radio 96.1 FM. Until next time, stay healthy, stay informed. Bye for now.